Hola everyone, this is going to be a lecture covering chapter 17 and that has to do with diseases of the circulatory system and the central nervous systems. We're going to talk about mechanisms of contamination of blood products, identify pathogens associated with infections of both the CNS and the circulatory system. And then we're going to talk about various infections caused by the pathogenic invasion of the structures within each of those systems. I think it's important to reiterate how crucial it is as surg techs for us to not only protect the patient, and we talk a lot about that, right? How important it is to protect the patient, and it is definitely, but also to protect ourselves. And that's where, practices like standard precautions come into play, as well as when we're passing and handling sharps. And that's a big part of what we do. And you will find some facilities and some surgeons are very willing to practice hands-free techniques or the use of neutral zones or no-touch techniques for passing sharps, but other physicians will not have that. So, we need to know how to pass safely, but we also need to know how to use these hands-free or neutral zones or no-touch techniques as well. We'll definitely learn that. In addition to that, wearing the proper PPE, and specifically, I want to speak to eye protection. Wearing your glasses in surgery is not sufficient, just wearing your spectacles. You're going to need some other sort of protection for your eyes so that you don't get blood splashed in your eye or some sort of dirty fluid splashed in your eye, because that would be really terrible. And I just had an incident where a student was at a site and said that they do not provide eye protection. So I want you to know that the site should be providing all the PPE that you need, and if they are not, that needs to be communicated to us immediately because your protection is essential. Remember from anatomy class that hematology is the study of blood and serology is the study of serum. And serum is what is left after we take pretty much everything else out of the plasma. Hematology primarily focuses on the solid components in blood, such as the white blood cells, the red blood cells, and the platelets. Remember that an average individual has about 5.5 liters of blood, and about 45% of that is cells and 55% of that is plasma, like you see here in this little image. And after we spin it down and we separate all of those parts out, we get the plasma, which is predominantly water, 90% water. And then there are some solids that are dissolved in there, and that includes proteins, carbs, enzymes, vitamins, lipids, salts. And after we remove those things, or some of those things, the clotting factors predominantly, we get this yellowish brown straw colored portion, and that is our serum. And in the lab, they use serum to determine if a blood sample contains antibodies or antigens to an infectious disease. Remember, antibodies is what our body makes in response to antigens. Antigens are what the invaders make or put off. Okay, so two commonly used tests are the agglutination and the ELISA test. Western blot is another one that's specifically used to test for Burgdorferi. Remember, that's the one that causes Lyme disease or HIV. And they can use a special process called electrophoresis, which is using electricity to move particles through a medium for analysis. And that medium could be paper, it could be gel, it could be whatever. These processes are going to be used to identify infectious diseases. Getting a blood transfusion is typically safe, and it's very rare that blood samples are contaminated and then that is transferred to the recipient. However, there are some bacteria, viruses, parasites, prions that have a higher propensity of being transferred from donor to recipient, and we're going to talk about some of those. So first, bacterial blood contamination. Two most common ones, Staph aureus and Staph epidermidis. These are ones that live on the skin, remember? And so the thought is that when there's that needle poke through the skin, there is residual Staph aureus and epidermidis on the skin that gets that moves into the hollow needle, and then it enters into the donated blood. It's not necessarily systemically in the patient's blood, but because of the skin. That's why it's so important to cleanse the skin, and alcohol has a contact time, and so they should be allowing for that to sit on the skin for the required amount of time before they do that. Other gram-negative bacteria such as Acinetobacter, Klebsiella, and Escherichia are also some other ones that can be in the donor blood. Parasitic blood contamination. Now, when somebody is going to go and give blood, they ask them to fill out a questionnaire, and that questionnaire is going to ask them about their general health, their personal habits, their social behaviors, their travel. Have they traveled out of the country? Have they gotten a tattoo recently? Those kinds of things. As far as parasites that can be in donated blood are those that include anaplasmosis, babesiosis, Chagas disease, malaria. A lot of these, as I was looking through here, I realized that a lot of them have something in common, that they're transmitted by vectors. They're vector-borne diseases. Viral blood contamination is rare as well, and again, we have vector-borne types of diseases like dengue fever and the chikungunya virus. And then thrown in there is Hep A as well, which isn't a vector-borne illness. It is transmitted through the fecal-oral route and contaminated foods. However, they will do a blood screening previously to you donating blood, and they're going to look for things like the Hep B virus, the Hep C virus, the HIV, and then also human T lymphotropic virus and the West Nile virus. Prions. Prions can also be something that are in the donor blood. We talked about prions causing Creutzfeldt-Jakob's disease, or CJD. There is also a more recent strain that they labeled rapid progressing variant, or VCJD, that can be transmitted through blood transfusion or donated tissues like the dura. And so if there have been individuals that have traveled outside of the US, specifically into the United Kingdom, they are going to exclude them from donating blood or donating tissue. Here's just a little fun slide that I threw in here to kind of shake things up. And so a question that we can ponder is, how many of you have rubbing alcohol in your cabinet at home? I'm willing to guess most of us do. I know I definitely do, along with peroxide and other fun things. You know, and so what might we use it for? Cleansing a little cut, or something of the sort like that, right? So what are your thoughts about, does it kill Staph aureus? What do you guys think? If you were to vote out loud right now, what would you say? Yes or no? Let's find out. So alcohol is going to kill these guys listed here, like Staph aureus, strep pyogenes, E. coli, salmonella, pseudomonas, tuberculosis, HIV, hepatitis, herpes, flu, and some other fungal stuff, but not all. Okay, so kills quite a few microbes. I think that's pretty good. If you had to rate it on a scale of 1 to 10, how would you rate alcohol? So let's talk about the contact time. Contact time, or the dwell time. So let's define contact time. Contact time is known as the kill time or the dwell time, and that's the amount of time that any disinfectant needs to be present on the surface. The thing with alcohol is it dries super quickly, and so sometimes that can affect or impact the contact time because it does dry so quickly. So if you had to guess, what would you think alcohol's contact time is? Would you say it was a few seconds, half a minute, a minute? What do you think? Let's find out. Alcohol's contact time is 10 seconds. 10 seconds. So it should be in contact with the skin for 10 seconds, or any surface, whatever. But if we're thinking about blood donation and we just give one little wipe where we're going to get the blood from, that is not 10 seconds. That's maybe 1 second. So maybe 10 little circles with the alcohol swab is going to be a lot better than just one little swipe across, right? It's probably not going to do its job. So again, we'll go back to, scale of 1 to 10. Do you think this is a good antiseptic or disinfectant for hospitals? Why or why not? For me, in my mind, I think it's not the best. And the reason why is if we go up and look at our list here, we are going to be looking at bacteria specifically that do not make spores. And the thing about alcohol is it does not kill spores. Therefore, my vote is nay, nay. Circulatory system infections are typically referred to as bacteremia, and the way that an individual gets bacteremia is by whatever mechanism the bacteria uses to get into the host. That could be that there's a break in the skin, so that could be a minor break, or it could be a wound from surgery. It could also be through blood transfusion. Healthcare associated infections of the blood are becoming more common and are often related to surgical procedures or indwelling catheters, or if the patient is in surgery to receive some sort of an implanted device, whether this is a joint replacement, a pacemaker, a valve replacement of the heart, breast implants. The list can go on and on as far as devices that we may implant into the patient. If antibiotics is unable to control the bacteremia, that is going to lead to septicemia, and that is a whole systemic, the whole body bacteremia, right? That can escalate to septic shock, and those individuals that experience septic shock, 40% of them, half of them will die from that infection. Some symptoms that we can look for of septicemia or septic shock would be hyper or hypothermia, tachycardia or hypotension, altered mental status, or rashes or changes in the skin. Those that are at our highest risk of developing septicemia are our immunosuppressed patients. Those that have HIV, long-term steroid use, have had an organ transplant, have undergone radiation or chemotherapy, and those little ones, premature little babies in the NICU, they have a higher chance as well as elderly individuals. Gram-positive and gram-negative bacteria are equally responsible for circulatory system infections and can infect a variety of systems, including respiratory, GI, skin, the urinary tract, and the central nervous system. One serious infection that can result from bacteremia is endocarditis, or inflammation of the innermost lining of the heart. And this lining is also what covers the valves of the heart. And this is typically where we see the endocarditis. It can also, because it does attack the valves, it can lead to incompetent valves or insufficiency of the valves, which can lead to heart failure. There may also be abscesses that are seen in the muscle of the heart, the myocardium. Those that are at a highest risk are those that already have a damaged heart or have experienced trauma or some sort of infection that is from another part of the body. They had an infection somewhere and then it traveled to the heart. Those that are IV drug users, as well as those that have unprotected sex, are at a higher risk as well. Death is really high, and if left untreated, it's pretty much fatal. There are two types, acute and subacute. Subacute is slow to develop, where acute is a really sudden onset of endocarditis. Subacute is typically caused by streptococcus, sometimes enterococcus and staph as well. Again, where there's infections originating from another part of the body, they may travel to the heart and cause the subacute kind of endocarditis. When we're having dental work, if we're going to have extensive dental work, a tooth pulled, something like that, the dentist will often prescribe antibiotics, and this is to prevent that bacteria that might be stirred up in the gums from entering the vascular system and traveling to the heart. Those individuals that already have something going on with their heart, let's say they had rheumatic fever as a child, and so now they have damage to their heart valves, or they have some sort of stenosis. The bacteria likes to colonize there, and when it does that, it causes agglutination of the blood, and so there are blood clots that could potentially break away and go floating through the vascular system and get stuck somewhere and cause a thrombosis. It could be a pulmonary thrombosis. It could be a cerebral blockage as well. Prosthetic valve endocarditis is involving those individuals that have had a valve replacement. There's two different types of valves. There's mechanical ones and there's bioprosthetic ones. So mechanical ones are made out of stuff from the lab, where bioprosthetic ones are made typically of tissues of pigs or cows. So they're at a higher risk. Bioprosthetic valves account for about 5 to 10%. But mechanical valves have a tendency to become infected much more quickly than the bioprosthetic ones, and Staph aureus is usually our culprit there. Individuals that have pacemakers or defibrillators are also at a higher risk of this, as well as, like I mentioned, those that use IV drugs are at higher risk of developing infective endocarditis. There's also a fungal endocarditis that intravenous drug users can get, as well as ICU patients. We'll continue our discussion of circulatory system infections with myocarditis. Myocarditis is the inflammation of the heart muscle, and it is typically caused by a variety of bacteria, viruses, and fungi. They're listed there for you. There's quite a few. Sometimes symptoms can be mild, or the individual might not even have symptoms, but if it goes undetected and untreated for a long period of time, it can result in heart failure due to cardiomyopathy. Other symptoms we might look for: abnormal heartbeat, chest pain, lightheadedness or feeling tired, stabbing pain in the chest, flu-like symptoms, swelling, and decreased urine output. Pericarditis is another circulatory system situation that can result from bacteremia. And pericarditis is inflammation of the pericardium, and it can take on many forms. It's typically caused by streptococcus. Occasionally it can be caused by a virus, but that is not very often. Another form of it is chronic pericarditis. And with chronic pericarditis, the pericardium eventually sticks to the heart. It does this because it forms adhesions there. If this is the case, then the individual is going to have some sort of surgery to free up the pericardium from the heart so that it can work properly. There's also a tuberculosis pericarditis that's caused by the Mycobacterium tuberculosis bacteria. What can happen here is that fluid, due to the infection, fluid can leak out from the pericardium and it becomes trapped between the heart muscle and the pericardium, and this eventually will cause a cardiac tamponade because that space, the pericardium can only expand so much in that space. And so eventually that fluid that is in there is going to start pushing back on the heart, and the heart's not going to be able to beat properly. So in this case, the patient is going to need something called a pericardiocentesis, where they stick a needle into that space and withdraw fluid, and they may have to do that several times over if it continues to occur. Something else that they can do if it does continue to occur is something called a pericardial window, where they cut a little piece out of the pericardium. Vasculitis. Vasculitis is inflammation of a blood vessel. Could also be referred to as angiitis, which would be an inflamed artery. Because of the inflammation that would occur in the vessel, this is going to cause narrowing, it's going to reduce blood flow, it's going to increase resistance, it could lead to ischemia, or the formation of an aneurysm. And the way that they treat is with antibiotics and corticosteroids. And then let's talk about Pseudomonas aeruginosa, our friend. We've already talked about P. aeruginosa earlier. It is a common infectious agent with burns and puncture wounds. Remember, it likes to live in pools and spas and sinks and fun places like that, indwelling catheters. It has a pigment. Remember, we talked about how the wound can look dark, and that's because it produces a pigment called pyocyanine. And this can cause the pus to have a blue tinge to it. It also has an affinity for invading blood vessels, and that is referred to as ecthema gangrenosum. Leviosa. No. It can also lead to endocarditis in those that have prosthetic heart valves, and those that like to inject recreational drugs can also become infected with P. aeruginosa as well. So think back to anatomy class when we talked about the nervous system. We mentioned something called the blood-brain barrier. And if you remember, there are several types of neurons and supporting cells to the neurons, and one type is the astrocyte. And the astrocyte is the type of cell that's responsible for making the blood-brain barrier possible, and they're really tightly connected together, and this forms a barrier that makes it difficult for large particles to pass through. So it does remain permeable to things like water, oxygen, CO2, alcohol, glucose, and anesthetic drugs. However, sometimes when things get in, like prions, or we have individuals that have Alzheimer's or Parkinson's, it's very difficult to treat because of this unique blood-brain barrier. And researchers still continue to look for ways to treat the brain and trick the blood-brain barrier so that we can get our arsenal of weapons past it to take care of the brain. But they're still flummoxed regarding how to best do this and circumvent that mechanism, that protective mechanism of the brain. Now, there isn't a barrier that exists between the brain and the cerebral spinal fluid, and that's because the ventricles, the cells that are there, they don't form those really tight junctions like the astrocytes do. Now, even though that blood-brain barrier plays a big role in protecting the brain and keeping foreign invaders out, the brain is not 100% impervious to them. So some bacteria, viruses, and fungi, along with prions, can invade the brain by crossing that blood-brain barrier or by entering through some sort of traumatic wound or injury, surgical injury or wound, or an abscess that is located nearby, like the ear or the nose or the mouth, and then can migrate there to the brain. So let's specifically talk about meningitis. Meningitis is an inflammation of the meninges. Remember, there's 3 protective layers of the brain, and that's the dura, the arachnoid, and the pia. And so with bacterial meningitis, That is specifically an infection of the pia and the arachnoid layers, and it is life-threatening. Some common causative agents are Haemophilus influenza, Streptococcus pneumoniae, Neisseria meningitidis, and E. coli. These are normal residents that colonize the nose and the upper respiratory tract and the GI tract. And so as a result, they often infect the central nervous system, more likely when the individual is immunosuppressed. It can also have an increased incidence in those individuals that have endocarditis, pneumonia, or otitis media. Remember, that's that middle ear infection. Little ones that are under a year old or around a month old have a very high incidence. They're a lot more susceptible because their little immune systems aren't very well developed yet. And so they're at risk from getting this bacterial meningitis due to Streptococcus, E. coli, Listeria monocytogenes, Strep pneumoniae, Haemophilus, and Neisseria meningitidis. If the infant develops meningitis due to an E. coli infection, the mortality rate is very high and can be upwards of 80%. In adults, not nearly as common, but if an adult does get meningitis, it's typically due to the Neisseria meningitidis, Staph pneumoniae, or L. monocytogenes. There are vaccinations here in the United States, and those are highly suggested. Symptoms could include headache, stiff neck, sore throat, vomiting, irritability, drowsiness, coma, and death can be a result. I think we talked about this before, but Waterhouse-Friderichsen syndrome is caused by the Neisseria meningitidis, and that can also result in symptoms like diarrhea, seizures, internal bleeding, hypothermia, and shock. And in those that are under 2 years old, they typically have fever and lethargy, and they can have seizures as well. They can also have that characteristic rash that we had talked about I think it was in Europe, about using the tumbler, clear glass. And if they press the clear glass to the skin and the little rash didn't go away, then they needed to bring their baby in immediately. Chronic infections can occur due to bacteria that cause tuberculosis, syphilis, and Lyme disease. And then our dear friend Pseudomonas aeruginosa is also a causative agent as well. In regards to Haemophilus influenza, that can also cause meningitis, and that typically starts out as otitis media, and that's right near there knocking on the brain. So it can migrate into the bloodstream, travel through the lymphatic system, and get to the meninges of the brain. Diagnosis, treatment, and prevention. So to diagnose, we typically look at cerebrospinal fluid and blood. Those are the two best fluids to culture. And as far as the Haemophilus influenza meningitis, that HIB, the HIB vaccine, is recommended for little ones to get that. Fungi can also cause meningitis, Cryptococcus, Histoplasma, Blastomyces, Coccidioides, and Candida are common ones, and most frequently they're healthcare associated infections. And then our friends that have immunocompromised situations are going to be some of those that are at highest risk. Two other types of meningitis are parasitic meningitis and viral meningitis. Viral meningitis being the most common, parasitic meningitis being the most rare. Now, parasitic meningitis is caused by an amoeba called Naegleria fowleri. And it causes primary amoebic meningoencephalitis, or PAM. And the way that individuals get this is by swimming in warm waters such as lakes, ponds, rivers, or underchlorinated pools and hot springs. Neti pots have also been found to be a source of transmission. And so it enters through the nose when you're swimming in these waters, if this parasite is there, and it travels to the brain through the sinuses. Now you can't get it from ingesting the water, just from getting it up your nose. There were only 31 cases reported between 2003 and 2012, but they were all fatal. Symptoms mimic bacterial meningitis, but the disease progresses really fast, invading and destroying brain tissue, and results in death within about 5 days. There are other parasites that could potentially cause parasitic meningitis, like Toxoplasma gondii and Taenia solium. Viral meningitis. Like I said, the most common form of meningitis, and they are, the causative agents are non-polio enteroviruses, Coxsackie virus, enterovirus, echovirus, and pericovirus. There are a variety of others that are listed, like herpes virus and measles and flu and West Nile, that could potentially result in viral meningitis as well. Encephalitis is inflammation of the brain itself. It is considered to be more dangerous than viral meningitis. It can be caused by viruses, the viruses that we talked about previously, as well as arboviruses and rabies. Now, herpes simplex encephalitis is the most common type that occurs in the United States, and if it's not treated, there's a 70% death rate. It typically destroys the temporal lobes, the sides of the brain, and the areas of the orbital frontal region. Now, there are some mosquito-borne viruses that can cause specific types of encephalitis as well. Paralytic poliomyelitis is a virus that also targets the central nervous system. And then we have rabies. And rabies is a type of encephalitis as well. And in the United States, it's typically found in wild animals. Now, if you don't get your domestic animals vaccinated and a wild animal bites them, or they bite a wild animal, they could potentially get rabies. I'm thinking Cujo here. But typically wild animals like skunks, foxes, raccoons, and bats are known to carry the rabies virus, and then they bite another animal, or they bite us, and that's how it's transmitted. Symptoms typically include fever, headache, seizures, and a vaccine is needed right away before those symptoms start, or death is a guarantee. Brucellosis was first isolated by David Bruce during an epidemic among British soldiers on Malta Island in 1887, and it typically takes its name from wherever the outbreaks occur. In the United States, it's not very rare, but cases that do occur are mainly in developing countries with agrarian societies.
Acute brucellosis has symptoms that are similar to the flu, and in most cases they resolve themselves with some antibiotics, with a course of antibiotics. But in some cases, chronic brucellosis can occur, and those symptoms can reoccur and repeat themselves for several years into the future. The most serious complications are endocarditis, meningitis, and encephalitis. A brain abscess is a collection of pus that typically occurs in the frontal or temporal lobes of the cerebrum. The pus can be free or it can be encapsulated, like here in this image you see kind of a delineation there. So that would be an encapsulated type. It can occur in one area or multiple areas, but it's typically secondary to another infection, such as that otitis media or mastoiditis or sinusitis. Also, an infected tooth could lead to a brain abscess or other infections associated with the heart or lungs. Symptoms are going to include increased intracranial pressure, right? Because we're going to have an excess of fluid in there taking up space in a confined compartment. Headache, nausea, vomiting, difficulty seeing. It could have paralysis of one side of the body or the other. And they're going to take a look at the brain with either a CT or an MRI to diagnose and to figure out where the abscess or abscesses are located. And then the individual is going to have to go to surgery to have those areas cleaned out. Something else that can occur is subdural empyema, which is a collection of that pus just underneath the dura. Again, can be a complication of sinusitis or otitis media. It can also result from bacteria entering through a penetrating head trauma or head injury. Again, surgery may be required to drain the pus, relieve the pressure, and then the individual would be treated with antibiotics. This concludes our discussion of diseases of the circulatory and central nervous system. I think this is a little bit more interesting because we can see how these things connect to what we do in surgery. So I'm excited to get into class with you and kind of take a deeper dive into some of these different situations and take a look at how we address them surgically.